Hey everyone, this is Dr. Perry Nicholson coming at you with the very first In the Trenches Spotlight segment for LiteCure Medical. And I'm really excited to have someone on here who's a dear friend of mine and a respected colleague, and he's got some great things to share about the LiteCure laser that he's using in his setting. And I've got Al Wood on the line, who is a certified athletic trainer and certified strength and conditioning specialist. And he runs the Director of Sports Medicine Department at St. Andrew's School in Delaware, and they actually just had a brand new facility put up down there that's just absolutely spectacular, and he shared some of his success rates with the laser, so I said, man, just come on in and start to share it. So Al, thank you for coming on, my friend.
Thanks for having me. Really appreciate it.
Anytime. So let's go over a couple things here. Why don't you tell everyone how you got started into the laser and the LiteCure, what kind of turned you on to it to use it in your setting with the students?
Well, really was introduced to it through great mentors like yourself, Dr. Mark Chang, Dr. Rob Butler, and just hearing all the positive results that you guys were getting, especially when combining it with functional movement and removing movement dysfunction patterns for athletes. So really did a lot of research into it, and along with a lot of the new equipment we were able to go out and get while setting up this new facility, the LiteCure became a high priority for me to put it at the top of my list for new equipment.
Yeah, absolutely. And I mean, I came down there and visited you at your facility and brought my laser down there for you to take a look at, and we used it on some students, and the feedback was good. And you're working with high school level kids and stuff like that are into a lot of sports, and you see all types of different injuries. So what type of pain syndromes or injuries are you treating in that environment, and maybe some of the things that you're really noticing some substantial kind of improvements and changes and stuff that used to be very difficult?
Well, the vast majority of the athletes I'm working on are between the ages of 14 and 18. Right now in the fall season, I'm treating mostly repetitive use lower body injuries to boys, girls cross-country runners, boys, girls soccer players, field hockey players, and football players. And the vast majority of those injuries are, you've got your medial tibial stress syndrome, kind of shin splints, your patellar tendonitis, a lot of calf and Achilles strains, especially in soccer players and cross-country runners, especially down there behind the calcaneus, and some plantar fasciitis, and then your general kind of hip flexor, hamstring, and IT band kind of irritations that pop up from these explosive sports. But one of the best examples and one of the biggest surprises that I had with using the LiteCure laser was I had a cross-country runner, male cross-country runner, who had been dealing with Osgood-Schlatters disease for about a year, and you know how tricky and difficult those can be to manage. So basically he had been on long-term anti-inflammatories, really no end in sight, had tried to work his training volume and intensity of running around the pain, and really was just really depressed that he couldn't just go out with his friends and run the way he had wanted to. This kid's going to be a lifelong runner. So he came to me, and we evaluated some movement dysfunctions, but we weren't really going to get too deep into those until we just gave him some pain relief and really got some healing going. And what we were able to do, and neither one of us expected this, was by the fifth laser treatment, the athlete was pain-free.
Wow.
Yeah, exactly. It blew me away. It blew him away. And as soon as he got that genuine healing, I feel like his body really wanted to heal, but he needed that catalyst to really just kick-start it and finish the job, and that's what the laser did. And as soon as that happened, we go after dysfunctional movement patterns, and he's back on the cross-country course, running, having fun, and a couple weeks later he PRs in one of the toughest courses in the state of Delaware, and that's what it's all about right there.
That's it. That does say it all right there, and I'm sure his parents were thrilled too.
Exactly. He's actually called his sister, who has the same issue, and is trying to get her to come here just so she can get some relief herself.
Yeah, well, that's how it works. I mean, you know, in any setting, I tell the doctors, I mean, if you're in a setting like you are and you treat athletes, I mean, those athletes, when you get them better and they can do what they want to do and really love to do, I mean, they'll just tell every athlete in the world because they're just so excited, and it does that with any population that you're doing. It's just, you know, helping people the way you're supposed to, but getting the really, you know, in the trenches results. I mean, that's such a fabulous thing. So I guess that, you know, overall you get some good feedback from your students there, right?
No, it's been great, and even they don't know what to compare it to a lot of times. In that, I know in years past, even with you know, doing everything just the right way, how some injuries can just stall and delay for no reason, and this really helps just take that healing process. I mean, these are young, healthy athletes. Their bodies want to heal, in my opinion, and this just takes that and really does a great job of finishing real, deep, authentic healing.
Yeah, absolutely, and I think it's good too. You mentioned the point too. It's just another tool in the arsenal. You know, you put it in there, and sometimes it can be the one ingredient that you need, but you can easily integrate it with everything else that you're already doing.
Exactly. And I feel good about the fact that my athletes are going to be on less anti-inflammatories. They're going to miss less time with their teams. They get to just do what they want to do, which is go out and have fun, compete, grow. You know, just be, you know, a bigger part of the process.
Yeah, absolutely. And I would think that also, too, in a roundabout way, you're going to have some nice relationship established with some of these athletes if they have, you know, their own sports doctors or people that they see outside of things that they consult on. I'm sure that you'll have a nice kind of back and forth conversation or relationship now when they share what they're getting with you.
Yeah, I mean, I've already had a few athletes and parents. I've gotten a few emails from doctors asking me, so, you know, I'm curious, what is this laser that you're using right now, and you know, what does it do? And you know, I normally you know, explain that. So, you know, I'm normally a pretty skeptical person, but the results just speak for themselves, and it's just been amazing. It's been probably the best purchase I've made as a director of sports medicine here at St. Andrews.
Oh, that's great. That's what it's all about, man. I mean, I'm really excited to hear that, and for the great stories and feedback. And I'd like to end with one. If you, you know, I'm sure I know the answer to it, but I mean, if you had people out there that are listening who are just maybe on the fence or not sure about, you know, getting the laser, if you know, maybe they can reach out to you if you're easy to contact, and you can let them kind of know a little bit more about things if they have questions, and what you might say now to people that are kind of like you were at one point. You're like, I'm not quite sure. Maybe I should look into it, sort of thing.
Well, I mean, anybody can obviously contact me, and you know, I can give you my contact information to post on LiteCure's website, and that's fine with me. I love the idea of the laser and combined with functional movement in the high school setting. Like I've said to you before, you know, these minor injuries from our youth, when they're not healed correctly, become those chronic conditions of our adulthood. And it's great to know that, you know, these kids that I'm treating right now, that when they're 30, 40 years old, they're not going to be saying what you hear a lot of nowadays where, well, I can't do things because of my old football injury. I can't do things because of my old soccer injury. So they can be functional athletic adults.
That's great. That's what it's all about. Well, Al, thank you so much for coming on. I know you've actually got to get on out of here and do some teaching yourself, so thank you for taking a few moments to share your success stories with other people.
Thanks for having me on, Perry. Anytime.
You got it. You take care. All right, everyone. I hope you enjoyed this episode. It was a fantastic one to start off with. I'm really, really excited about it, and this is really what it's all about, you know, changing people's lives, getting good results, and making it happen. So this is Dr. Perry signing off from the In the Trenches Spotlight segment. We will see you soon on the other side.